I'm Anne McNair. I'm a social research scientist in public health in our assessment policy development and evaluation unit. We work on the evaluation team for Best Arts for Kids, and I've been an evaluator for some of our prenatal to 5 BSK strategies, as well as some of our qualitative analysis work that we do across BSK. And Sarah J., would you like to introduce yourself?
Thanks, Anne. Good morning, everyone. Thank you for joining us. My name is Sarah J. I use she, her pronouns. I'm also an evaluator on the Best Arts for Kids data and evaluation team, and my focus is mostly around building capacity and managing capacity building supports related to data and evaluation for our community-based partners. Christy?
Good morning, Christine Stolley. I also use she, her pronouns. I am the program manager for the Best Arts for Kids data team, and I'll be here today helping to support with any questions that you have. Again, if you have any technical difficulties, feel free to type that into the chat and I'll be here for you.
Great. All right. So let's start with a little bit of background about evaluation and Best Arts for Kids. Evaluation has been a piece of Best Arts for Kids since the beginning of the first levy. We're really focused on using evaluation and data for learning to ask, what's working, why is it working, how can we improve together, what successes should we celebrate. We also use evaluation for accountability. Being a publicly funded initiative, we have accountability to the community as we are funded by community money. And we also have accountability to our vision for BSK. You've heard the phrase happy, healthy, safe, and thriving. And we use a lot of different evaluation approaches to try to understand if we're seeing the changes we want to see to help families really thrive in King County. So we do have an evaluation framework we use to try to make sense of kind of all the complicated different projects going on across the initiative. So we use performance measures to collect information about programs and participants from grantees, contractors, partners, people who are doing programs on behalf of Best Arts for Kids. So they're collecting data and sending it to us pretty regularly. Then we also are using data that we call indicators. And indicators are information about all of King County. And those could be from many different sources like Department of Health, schools, and the Best Arts for Kids Health Survey, which is something that we have created and implemented in-house in partnership with University of Washington over the years. And this RFP that we're going to talk about today is going to be another source of data that we hope will help think about our indicators and the effect of Best Arts for Kids at that county level. Over the years, as we've been running the BSK Health Survey, we have done a lot of community-based work. We've had a component of the survey where we partner with community liaisons and other grantees to really try to make sure that the survey is getting out to populations that aren't likely to participate in the survey. And throughout all of that work, we've really started to capture a community vision for what the BSK Health Survey could look like if it were designed collaboratively with a lot of the families and partners that are part of Best Arts. So for Best Arts for Kids 2.0, we are splitting up our BSK Health Survey budget into component 1 and component 2. So we'll continue to field the Best Arts for Kids Health Survey, just a slightly scaled back version, and that RFP is currently open now. And in August, we'll be releasing another RFP for the second component, which we're calling community-led data. So that's about a $500,000 budget, and we'll be funding different projects where partners are collecting data themselves related to some of the topics that we look at in our population level indicators. I can share a bit about the primary purpose of this RFP. So our goal is to fund community partners to collect data using community chosen processes that will help BSK understand and evaluate what's changing for families. That means, that the methods and approach to collecting the data would be proposed by applicants for the RFP. We're just providing some guardrails about what information we hope the data will be related to. One of the primary goals is to be gathering culturally specific knowledge and experiences that help paint the context around the key BSK indicators that are publicly reported. And a secondary goal for this work is to build community partner skills to collect, analyze, and share data. And I really just say secondary because I don't imagine that these projects would have deliverables, or we would be trying to measure. It's not a capacity building grant, but as we work together to collect data, we want to be providing supports to make sure that you have everything you need. And now I'll pass it to Sarah J. to talk a bit about some of the scope for this RFP.
Thank you, Anne. So we're currently still in the process of developing this program, and would definitely welcome any feedback that you have about these topics. So one aspect that we're thinking about is who should the focus populations be for this funding. We know there's so many communities in King County and many more than we can reach with the scope of this project. The data that we currently use for the population level indicators comes from sources like the Best Starts for Kids Health Survey, schools, and the Department of Health that cover the majority populations who interact with these systems. So we want the data that is developed through this program, this RFP, to tell the untold stories behind the indicators and really represent families that are not feeling represented in some of those bigger data sources. So that's, broadly speaking, our focus population. And if you have any ideas about other populations or more specific populations that it is important to focus on, we'd love to hear your thoughts on that today. Is there anything in the chat, Christine?
Not at this time. I'll let you know.
All right, think about it and let us know at the end. The other aspect of scope that we're working on developing is what kind of topics. As we've said, we want to hear the untold stories that aren't represented in some of our bigger population data about these indicators that we use to understand what's going on for King County families and evaluate best starts for kids. And the examples of these current indicators that we use for the prenatal to 5 area of best starts for kids is that babies are born healthy as measured by infant mortality or preterm birth. Children are thriving and are kindergarten ready. Babies are breastfed. Children are healthy. Childcare and preschools are high quality. Parents not missing school or work due to needing to provide childcare. Families are resilient and have hope for the future. Families have positive relationships and social supports. Children receive recommended health and developmental screenings and are connected to services if needed. Parents and caregivers have knowledge of parenting and child development, and families have concrete support in times of need. Finally, children have strong parent-caregiver relationships. So you can see that these indicators cover a really wide range of topics. And so again, as we work on developing this RFP, we're thinking about, are there more certain indicators that we really want to focus on, or should we leave the door kind of wide open for what community proposers are interested in focusing on? Again, we really welcome your feedback.
You have nothing in the chat yet, but we encourage folks again to either type in your comments or to raise your hand virtually or unmute yourself.
Thank you, Christine. So getting down a little bit to brass tacks, our planned timeline for this RFP is to open it on August 8th. And so that will be when all the details are published, and interested applicants can participate in information sessions and start putting together a proposal if they're interested. Our planned closing date is September 23rd. So it gives a little over 6 weeks. We'll be working on proposal review that last week of September, first week of October. Once the review team has scored proposals and made recommendations, there's further internal processes that include things like review by Best Starts for Kids leadership, department heads, and King County Council. And we have a goal of executing those contracts by the end of this year, by the end of 2022. So I know that timeline gets a little wishy-washy towards the end, but the important thing to know is that RFP will be open in August and September, and we'd love for folks to be able to get funded, get started at the beginning of 2023. So with that being said, our tentative project timeline is that partners would start collecting and analyzing their data in 2023, again, using the methods that they choose and with support from us and other partners if they're interested in that. 2024 would be a time to share out and communicate those findings with our community, adjust strategies if needed, and do another round of sharing, collecting, analyzing, and sharing data in 2025. So we anticipate that these would be 3-year grants with likely 2 cycles of data gathering. And this would give us an opportunity to really build deep relationships, really dig into capacity building if desired, and you know, implement lessons learned from first round of data collection to the second.
Sarah J, you do have one question in the chat here. The question says, as a neurodevelopmental center, we are interested in a deep dive on the impact of race, ethnicity, language, or culture on early supports for children with special needs. Would something like this fit in?
And I see you.
I think so, definitely. Yeah, I think that those are connected to a lot of the topics on the indicators list that Sarah J shared. I think that's a great example. Thanks for sharing.
Yeah, thank you so much for that question. Christine, I see you're muted, so I'm going to guess there's not more questions.
Not at this time, but we encourage folks again to put those in the chat or to raise your hand and unmute.
Yeah, as I said, again, we're still in the process of thinking through how we want to scope the topics and focus communities. So there will probably be more detail once the RFP is released than we have now, but that also means it's still something that we would really value hearing feedback about at this point. All right, so skipping ahead, if you think that your organization might be interested in working with us on this community-led data and putting forward a proposal for this or any Best Starts for Kids funding opportunity, you can get free technical assistance that is available to any organization that's responding to a Best Starts funding opportunity or a request for proposals. There is a special emphasis on community-based organizations who are smaller, who may have less experience with government funding processes, but there's no eligibility criteria, so anybody can access technical assistance. These are consultants that are contracted by Best Starts for Kids, so they will work directly with you, but get paid by Best Starts for Kids, and they can help figure out, you know, is the idea that you have or that you want to fund a good fit for a certain request for proposals. They can help guide you through the logistics of the application process. They can help you tell your story, make sure that you're fully answering the application questions. They can review or provide feedback on draft proposals, but the thing to keep in mind is that they really are there to support you in creating your proposal. They cannot write it for you. But short of that, they can provide a lot of different kinds of support. So when our RFP opens, or any other RFP that you're interested in opens, there will be information about technical assistance in the RFP document itself. And you can also read more about it on the Best Starts for Kids website. We can drop this link in the chat, but the slides will be shared as well later, so you can find it. And basically, pick somebody who looks like they could be a good fit to help your organization, and go ahead and reach out to them. We recommend you reach out as early in the process as possible, but at least 3 to 5 days before the close of the RFP, so that technical assistance consultants, have time to help everybody who reaches out to them. So if you're interested, there will be a lot of support in putting together your proposal. And I think that's it for the formal content. We'd love to have just some more discussion, hear some questions, or if you have feedback on some of the questions that we posed to you as well. And I know some folks have joined that maybe missed a little bit in the beginning, so that's totally fine. If we want to jump back and need to cover any of that again, I think we could do that too.
Thanks, Sarah J. There was a question in the chat that I think Anne already addressed about children in foster care. I think this is related to the potential population focus.
Yeah, and I would just share that I do think that children in out-of-home care would be an important population that isn't well reflected in a lot of the data sources we have. So it makes sense. Sarah J, I also wanted to point out, I think we have one more slide about the tentative project timeline. Did we go into that one in detail? Did I forget?
I think I did cover this, and I'm more than happy to answer any questions.
Great. Okay. I think I was reading the chat at that time, and maybe you just missed it. Thank you.
Yeah, no, there's a lot to juggle. I'm seeing another question from Geeta.
Yes. Do public health employees or individual community members that meet eligibility have access to child support service through Best Starts for Kids, or is it only for organizations?
That's a great question. I don't work on our child care programs, but we could definitely find some contact information, maybe to provide you more information about the child care work. I know that there's child care health consultation that's been part of Best Starts for Kids for years, but there's some new programs getting going right now as well. I can't really speak to, but I know that our colleagues could.
Does that answer your question, Geeta, or you're welcome to hear more?
Thanks, Annie, because I'm always like, when I'm a part of CVE team at the King County, and the pandemic, like as I go into the more interiors, the zip codes in the low barrier areas where we are providing vaccinations, and currently the pediatrics and the baby vaccinations to go in forward, we have seen tremendous challenges, especially the families who I talk to. They constantly bring up how this pandemic has posed with the school closures, and how expensive the city has gotten. Like, some of the facilities here are charging anywhere from $2,000 or $3,000 for a monthly intake for the kids, and here there are parents working and trying to meet the ends meet. So I was really curious when I came across families that had foster children, and also concerning our own employees at the King County, the largest employer, with also the community and the individual families going through this challenge. I'm very excited about the Best Starts for Kids and the project and the whole upcoming plan for future years. So appreciate the answers, and I hope you'll look into this and bring in the information as it develops. Thanks a lot.
Yeah, thanks for sharing. I know we have a lot of new childcare work going on in BSK 2.0, but it's not necessarily included in this RFP. But there are other RFPs related to the childcare work too. Any other questions coming up for folks as you're sitting here thinking, or we're happy to also go back and share some of our earlier slides if anyone's interested.
There's one more question in the chat now.
Okay, great.
Would it be appropriate to apply for a project that is mutually beneficial to both an organization and BSK? For example, I work with midwives who offer care to people who are often high-risk pregnancies and who hold marginalized identities. We have excellent birth outcomes. We have been wanting to assess our programs and gather more community input to improve our own program. However, this could also align with the community-driven research to tell untold stories of BSK indicators. Would that fit?
I think so. I think it would be very related to our indicators around babies being born healthy. We have data sources for infant mortality and preterm birth, but there's so much more going on for families at the time of welcoming a child to the world that I do not think those stories are told with those data.
Yeah, I agree. I think this kind of work is really relevant to, babies being born healthy, such a key indicator. I guess I would just say think through how to frame it outside of just a process improvement or process evaluation for your specific services. That could definitely be like a part or a component of identifying like what's working well. Obviously, you're doing work that is really working well for these moms, birth parents, and families. But yeah, just keeping in mind that we're thinking about this not at a specific program level, but more at a community level, if that makes sense. And also, just because this is the work that I manage, if you're interested in learning some more like program evaluation skills, if you are Best Starts for Kids funded, we can also match you with some capacity building support around that. That's available to all Best Starts for Kids funded partners as well.
Yeah, thanks, Sergey. That's a great point about making sure to frame your proposal to find, to collect information that's applicable beyond just the context of your program. So more applicable for a broader community that would be accessing supports from programs like yours. I'm not sure how long ago this chat was. Let's see, it was a few minutes ago, but
Yeah.
can we reshare the RFP timeline slide? Okay, thanks.
Yeah, so, if we really are committed to doing our best to follow this timeline for the RFP open date and proposal review date. Like I said, the internal processes, they're a little bit, harder to give specific dates for, but we really hope to be able to notify and contract with partners by the end of this year. Again, keep your eyes out on the Best Starts for Kids blog or newsletter or social media, however you like to keep in touch for when this RFP opens in August. For folks that might have joined later, please do chime in if you're interested in kind of going back over the first couple slides, and we'd be happy to do that.
Another question is, who does the BSK survey currently reach?
Great question.
Great question. So it is a population-based or random sample survey. So we work really hard to get a representative portion of King County families. It goes out to parents of kids that are in 5th grade or younger. We have typically between about 5,000 and about a little over 6,000 responses each year that we have fielded it. We've done it 3 times in 2017, 2019, and 2021 over the life of the first Best Starts for Kids levy. We work really hard to make sure that it is representative of King County communities, and we're really happy to see that many families of color participate. Our numbers are very similar to overall proportion of kids of color in King County, as well as families with low incomes. So I think I mean, I love the Best Starts for Kids Health Survey. I've worked on it for years. I think it's a wonderful data source, but I think for any small community, it's a population-based survey is just not going to give us all the information that we know is important. So that's kind of my personal take. Like, it's a great survey, it's a wonderful survey, and it has, you know, limitations, even though we do have a representative, amazing group of families that have chosen to share their information with us by responding to the BSK Health Survey. When there's also, we know that it doesn't reach families that don't prefer one of the 7 languages that it's offered in. And again, just getting more to those untold stories that just don't show up in our quantitative data. Anne, is there anything you would want to add to that?
Oh, I think you covered it well. I was going to name the languages that the survey is available in are Chinese, Russian, Somali, Spanish, Korean, and Vietnamese. And we know there's many more languages spoken in our county. Another, I think, limitation that we've noticed about this survey is that it doesn't reach really young babies. So I think they're 6 months and older is the sampling frame. So we aren't necessarily reaching parents with newborns. And I put a link in the chat for our survey website. Unfortunately, it looks like our Tableau dashboard is down, but that should be temporary. And we have a couple of data briefs there that talk about information we've heard in reviewing the data with different community groups and community cafes. We also have the dashboard where you can see all of the data and the demographics for who's included. Hopefully that will be back up and running very soon. Does anyone else have questions about if their idea is a good fit, or are you feeling kind of on the fence if this is the right RFP for you? We'd be happy to chat through it. Hopefully you're all just excited to apply.
I'm going to put up this last slide that has our contact information on it. The slides and recording will be all posted on the Best Starts for Kids blog for this, as well as other sessions of today's open house. But we would love to hear from you if you have further questions or follow-up ideas.
maybe we can just hang out if anybody wants to talk more, but feel free to go if you have somewhere else you need to be.
One more question for you. Are there specific activities that are likely or unlikely to be funded? For example, paying research participants for their time, hiring staff to conduct surveys?
That's a really good question. If there is anything that's specifically excluded, that we will be sure to name that in the RFP when it comes out. And I think we would probably be likely to be looking for ways for research participants to be acknowledged for their time, whether that be, payment or other culturally relevant ways to show appreciation for people sharing their thoughts and experiences.
Yeah, I think both your examples make sense as activities that could be funded.
What about kids older than 5th grade? Sustaining the gains targets, older youth and young adults?
Mm-hmm. That is such a good question, and something we've been talking about with our work group to design this RFP. We are kind of split right now if we want to keep the focus on the early years, the prenatal to 5 range, or expanding it to include youth, youth age data. Do you have any thoughts that you'd like to share about why it's important to include the kids older than 5th grade? I think some of our logic was that with a limited budget, we wanted to be able to have some results that are coherent, and with 50% of the funding for BSK going into prenatal 5, it seemed like a logical place to focus because it also aligns with the population in the survey.
In the chat, it says, I work with Navos and I'm listening in for the school age program.
Okay. Would that be like elementary age, or you're saying like middle school, high school ages? Okay.
In the chat, it says elementary through young adult.
Mm-hmm.
Yeah, I will say that even if we do choose to focus on like the prenatal through 5 or prenatal through elementary school ages, we would be looking, that would be clear in the RFP. Like Anne said, it's something we're still thinking through right now. So if you're not getting clarity from us now, that's because we don't have it yet, but we will by the time the RFP is released. And B, we would be looking for proposals that really are focused on prioritizing those age groups. We wouldn't be saying, okay, you can't talk to a single family whose kid is now in 6th grade, or whatever it might be. It's not we would be looking for just like aligned priorities. It's not a matter of like very strict eligibility or anything like that.
And you might also notice that on the list of indicators we shared, there are some parent caregiver measures, such as protective factors and social supports. And I think that if you can make a case in your application for how supporting the family unit supports parent caregiver wellness, then I think that that could also be a way to frame that proposal. So we know that families who have young kids often also have older kids. But yeah, like Sarah J said, we'll make sure that that's very clear in the RFP. Thanks for bringing it up.
Thanks, Anne and Sarah J. If there are no more questions for today and people have questions later, how should they get in touch?
For now, feel free to reach out to any of the three of us. Once the RFP is open, there will be a designated RFP lead through our contracting process. And if you have